One college girl pulled out her cell phone. She was getting ready to go to school, showed me her college application. She said, look, I got to fill out my college application. I got to pick my gender to get into the university. Watch this. And she just started scrolling through the list of genders. And there were 18 to pick from, but male and female were not options on the list to get into the college. Now, when most Catholics hear this, there's a perplexity about it. Like, what are we supposed to do? And then you hop on YouTube, and what do you see? Watch this, conservative culture warrior just humiliate this woke trans activist snowflake. Like, okay, like that's our answer? Like, that's the best our mother church has to give to souls who are suffering in this way with gender dysphoria? And you're tempted, like, what am I supposed to do, though, honestly? Because if you're like me, you got friends who identify as trans. You got friends who identify as non-binary. If you're like me, you actually have family members like I do in the trans community, and these people are part of your life, and you care about them, and you wrestle with it personally. Okay, like, am I supposed to use the pronoun, or do we not do the pronoun thing? Or what if I experience gender dysphoria? What does God think about me? I think we should start there because it's the easiest answer, and it's clear as day in the Old Testament. It says right here, it says, God, for you love all things that exist, and you loathe or hate none of the things that you've made, because you would have not have made anything if you had hated it. And so God loves these individuals, as should we, but the question is, okay, how do we give them the truth at the same time as love? How do we propose clarity at the same time as charity? That's what I want to dive into. And obviously, 20-something minutes is not enough to tackle this whole robust subject. We're going to do what we can. Where would I begin? One, let's first distinguish gender theory from gender dysphoria. Gender theory, the ideology, from dysphoria, the experience. Well, what's the distinction? Well, gender theory is this idea popularized in the 1950s that male, female, basically the same thing. It's just cultural conditioning that makes us behave in slightly different ways, but it's really just nurture, it's not nature. And some companies have bought this on. In fact, Hasbro, the toy company, tried this out. They wanted to create a gender-neutral playhouse. Now, this is supposed to be a dollhouse that boys and girls would play with in the same way. Well, didn't go well. Here's what happened. They said, it soon emerged that girls and boys did not interact with the structure in the same way. The girls dressed the dolls, kissed them, and played house. The boys catapulted the toy baby carriage from the roof. Yeah, exactly, yeah. It's the boys. So, a Hasbro manager came up with a novel explanation: boys and girls are different. Well, you think so. But it raises a fair question. But what about the boy who does like to play with the dolls? What about the girl who prefers rough and tumble play? Do those preferences perhaps indicate that they were born into the wrong body? Listen to what Pope Francis says. He said, gender theory seeks to cancel out sexual difference because it doesn't know how to deal with it. We risk taking a step backwards. Removing sexual difference creates a problem, not a solution. And so these people who are trying to blur our sexual distinctions, in my opinion, we're reacting to this overly rigid gender stereotype we have in our culture, that if you're a woman, you got to fit into that Instagram mold. If you're a real man, dude, you better be into drinking beer and shooting deer and watching NASCAR. But what if you're not into that stuff? Like, what if you're like me and you're just not into it? Like beer? I don't even like the taste of beer. I'd rather have a glass of red wine. Well, do you like NASCAR? Dude, I'm sorry, dude, watching cars drive in a circle for 500 miles, I just don't get the appeal. Well, do you like hunting? I was like, well, I don't know, when I was a kid, I threw a rock at a bird and I hit it, and I still feel bad about that, okay? Like, look, I'm not this stereotypical American man. I'm not like some 6'5" football player. I'm a 5'6" chastity speaker, okay? Like, I don't fit the mold. That's fine, like, I don't fit the mold. I don't fit the mold, but who cares? Because I don't have to fit the mold, because I know I'm a man, not because I just feel so manly. Like, I know I'm a man because I've got the body of a man. And our bodies are not meaningless, they're meaningful. Again, listen to Pope Francis. He said these rigid gender stereotypes hinder the development of an individual's abilities to the point of leading him or her to think that it's not really masculine to cultivate art or dance. It's not very feminine to exercise leadership. These are bogus gender stereotypes. Most masculine man I've ever met in my life. And I got to see him 24 times. It was a man who deeply loved theater, poetry, and the arts. And his name was St. John Paul II. And I've never been in the presence of a more masculine man than that guy was. And you know what? Thank God. Thank God he didn't grow up in a culture that told him if he likes theater, he's not that much of a man. He wasn't burdened by these rigid gender stereotypes. Because when we are, it causes unnecessary questioning. Because gender stereotypes exaggerate our sexual differences, gender theory tries to eliminate them. Gender stereotypes try to get a person to conform your personality to match your body. Gender theory commits the opposite fault. It tries to get a person to conform their body to match their personality. So how do we even know what's male and female? A feminist I read, who's not Christian, stated it well. She said, a woman is someone with a female body and any personality, not a female personality and any body. But here's the question, what about when they don't line up? What about when you get a person who's very clearly, let's say, biologically male, but your internal sense of identity is female? This is called gender dysphoria. Now, to help you understand what that means, think of the word euphoria, intense happiness. Dysphoria is the opposite, a deeply felt distress because of a disconnect between my body and my sense of self. So what would that feel like? I could imagine, ask the guys in here, how much is it I'd have to pay you to dress as a woman for the rest of your life? Would you do it for $1,000? Most people are like, no. Okay, $100,000. No, not happening. Okay, $1 million. But if you want the money, you gotta go full send. You better be wearing a dress to mass. You go to the gym, you better be wearing Lululemon pants and a crop top. Like, you gotta go full send on this. Most fellas be like, not for $1 million. Okay, why not? For $1 million, why not? I don't know, man, I just feel totally embarrassed and awkward and inauthentic. But what if that feeling of disconnect was not your outfit, but was your body itself? This is gender dysphoria. Now, when a child experiences gender dysphoria, the studies are clear. 80 to 90% of the time, they desist, meaning by the time they finish puberty, they come to naturally identify with their biological sex. But 80 to 90% of the time, it goes away on its own unless gender affirmative care does not intervene. Now, what is that? I mean, that sounds positive. Shouldn't we just affirm people? Gender affirmative care is the idea that if you don't feel at home in your body, your feelings are not the problem. Your body is the problem. What it reveals is that your identity is trans, and so the only way to live an authentic life is to transition, which has 3 or 4 steps. One would be social transitioning. You could change your name, pronouns, restroom, clothing, sports teams. It's an external transition. The next step could be puberty blockers. These are drugs now being administered to children as young as 8 years old to block the progression of puberty. Well, how do you do that? Well, they give the kids a drug called Lupron. This is the same drug given to chemically castrate male sex offenders, and they're giving it to 8-year-old kids. But look, if you don't have puberty when you should have puberty, that's a disease. It's called Kallmann syndrome. So we're inducing a diseased state in physically otherwise healthy children, saying, well, we're just putting a pause button on puberty so they have more time to discover their gender journey. Wait a minute, this isn't just pausing puberty. This is pausing neurological development. This is pausing bone development, leading to spinal cord compression, leading to osteoporosis in 15-year-old kids. I mean, we've got girls going on the hormones that are experiencing menopause before they finish high school. And so you put the kids on the puberty blockers, it's just a pause button. It's not. It's a fast forward button to cross-sex hormones. Because 95% of the time you go on one, you go right on to the next, which sterilizes you. And the cross-sex hormones, these do not give you the reproductive organs of the other sex. You develop the secondary sex characteristics. So if you put the woman on T or testosterone, there'll be a deepening of the pitch of the voice, increase in musculature, a redistribution of fat in her body. But this isn't all that happens. Her risk of heart disease quadruples after this. The amount of testosterone in her body is 40 times as high as it should be. This is the same levels as if she had an androgen-secreting tumor in her body. And if she wants to keep up the masculinized look, she has to become a pharmaceutical patient for life. But if this isn't enough, the next step would be surgery. It's not a sex change operation. That's outdated terminology. There's a whole swath of different surgeries, from recontouring the forehead, shaving off the Adam's apple, top surgery, bottom surgery. One of the most common is top surgery. This is a bilateral mastectomy, a removal surgically of both of the healthy breasts. Who's getting this done? Oakland, California Children's Hospital is now giving it to 12-year-old girls. Los Angeles Children's Hospital, top surgeries for 13-year-old girls. Up the coast in Oregon, they just changed the age of medical consent to 14. Do you know what that means? Dude, you can't get a tattoo in Portland until you're 21. You can't use a tanning bed until you're 18, but you can have both of your breasts surgically removed at the age of 14 without your parents' permission throughout the entire state of Oregon. But where's the girl going to get the money? This is $10,000. GoFundMe.com, popular crowdfunding website. Go on there tonight, click top surgery. How many young women now are raising money to have this surgery? Last time I checked, it was 41,000 of them. And people aren't saying, hey, here's $10. No. Here's $5,000. Go be your authentic self. Now, when the surgery is over and the anesthesia wears off and the surgical dressings are removed and they see their body the first time, sometimes there's elation. Oh, thank God. I always hated my breasts. I'm so glad they're gone. Other times, a new dysphoria is spawned. Wait a minute, now that my breasts are gone, my hips look too big. Maybe I can get surgery on that too. And other times they look at their body in absolute horror. But what they all have in common is that you walk with them about 10 years after the surgery, the suicide rate begins to climb 19 times higher than the general population. And people will say, oh, it's because of you religious transphobic bigots. If you were more accepting of them, they wouldn't have taken their lives. That's not the big picture. The big picture is that 90% of people who commit suicide have a diagnosable mental health condition in need of clinical intervention. Typically, gender dysphoria is 1 point on a whole constellation of mental health challenges. In fact, there was a gender clinic in the United Kingdom that was shut down last year, and only once did they ever audit the incoming young patients. And they checked 125 and found this: 97.5% of them had coexisting mental health conditions. 42% of people in the trans community meet the criterion for an autism diagnosis. Often other things of trauma, of abuse, so many layers of complexity. I know of one girl, her sister was getting top surgery, and she asked her sister, why are you going through with the operation? They had been abandoned by their dad as little girls, and her sister said, you'll see, I'll be a better man than dad ever was. I mean, the layers of hurt that are sometimes present, and to say, oh, well, let's just have a surgical and hormonal intervention. No, we're actually depriving these individuals of opportunities to develop strategies to address core psychological issues by treating the body as if it's a false target of intervention. In fact, what we're doing is collaborating with mental illness instead of actually treating it. And so if the answer is not hormones and surgery, then what is it? Because the world says, look, if you don't accept them, then you're rejecting them. You're a transphobic bigot or a rational, compassionate human being. Are these the options, accept or abandon? No, Pope Francis would use a different word, accompaniment, to walk with these individuals in truth and love. Because if you love someone, you cannot lie to them. And Pope Benedict once said, the truth might hurt, but it will never harm. And it has an antiseptic effect. It can sting at moments, but there's a curative effect going on. Because if you love somebody, you simply can't lie to them. And obviously, it's a challenge. But the fact is, biology is not bigotry. This is why medicine is so sex-specific. Not just guys get prostate cancer and girls cervical cancer. No, human flourishing depends on our recognition of reality. And so men, you are more prone to infectious disease. Women, you're more prone to autoimmune disease. We exhibit symptoms of disease differently. A guy gets a heart attack, pain in the chest, pain radiating down the arm. Woman gets a heart attack, she experiences nausea, shortness of breath, and pain between her shoulder blades. If you suffer a stroke, the man will take longer to recover his speech after having suffered a stroke than the woman will, because men only use the left hemisphere of our brain to speak, whereas women use both hemispheres. This explains why if you hit a man hard enough on the left side of his head, he could go completely mute. If you hit a woman there, she'll just keep right on talking. And so, it's true. And so the reality is, though, I think this highlights the fact that sex is not, as we hear today, assigned at birth, any more than your blood type is assigned at birth. It's recognized at birth. And in biology, your sex is determined by how an organism is organized for reproduction. And in the human species, there's only two gametes. It's the egg or the sperm, that's it. Gonads, testes, ovaries, that's it. There's no third, there's no fourth, there's no spectrum. There could be disorders of sexual development, but these do not constitute a third or fourth sex. Geneticists have found more than 6,500 sex-specific genes, meaning your esophagus is male or female, your liver, your spleen, your arteries are male or female. In fact, every single cell in the body that has a nucleus is sexed and it's fixed. Now, some animals can change their sex. Japanese goby fish, it's fascinating. You look in the habitat, a bunch of female fish with one dominant alpha male. Reach in and pull out the male, and the largest remaining female will transition into a biological male within a week, capable of reproducing with the females. If you then reintroduce the alpha male into the habitat, the largest female who had become male will detransition back to female and again be capable of reproducing with the male. This is called sequential hermaphroditism. It's present in less than 1% of all of the animal kingdom, but it does exist. And human beings, obviously, it does not. Now, upon hearing this, a person who experiences gender dysphoria would certainly say, look, I'm not arguing with any of your science. I'm not even saying that I'm changing my sex. I'm swapping out my DNA. No, all I'm saying is that I just want to look how I feel, and why is that too much to ask? And so how do we respond to this? Well, one, I would say, yes, these people deserve to hear the truth, but they also deserve to be listened to. My challenge for you is that you would learn how to listen to gender dysphoria with reverent curiosity, because it's often a roadmap towards deeper healing. I was at a high school in Texas, and a boy came up to me and told me he was trans, and we sat down and had a great conversation. I said, well, tell me about your life. And he said, well, I got 2 older sisters, 2 younger sisters, and he's like, man, my parents love them, they're affectionate to them, but me, I'm the black sheep of the family. But I got straight A's, I do mixed martial arts, I'm on the swim team, but nothing I do is ever good enough for my parents. I said, well, do you think if you were born a girl, you would have been loved the way your sisters are loved? And he looked at me and I said, I know I would have been. And I said, this is it. The ache isn't to be female, the ache is to be loved, and you see the female identity as the pathway to that love. From there, we went to a junior high in Dallas. And after the talk, 6 7th grade girls came up to me, all identifying as lesbian. And I started talking to the girls, and they were not like erotically attracted to the 8th grade girls. They just thought the 8th grade boys were disgusting, which of course we know they are. And so instead of shaming these girls, I told them, let me just go out on a limb and say what your real ache is for is to be in a relationship where you're safe from objectification, where you can connect on an emotionally profound way without this fear, but you're replacing this whole story with just a label of lesbian. There's a deeper story to be heard. And so what we have to do, in a sense, is listen to them with love. And also not only to listen to love, but also to see them with the eyes of Christ. Not just the ears of Christ, but the eyes of Christ. In fact, I met a woman in California last summer, mom. Her adult son is transitioning. And she told him, look, I told him, don't come to my house. If you're going to wear your makeup and your mascara and your nail polish, I won't even look at you if you come to my house. And I said to this devout Catholic mom, I said, I'm going to push you on that. I'm going to challenge you on that. I said, do you remember when the Virgin Mary didn't want to look at her son either? She said, no. I said, come on, you don't remember? When they took down his body off the cross and they laid his unrecognizable form into her arms and her maternal heart was pierced, it broke her heart to see her son, but she did not take her maternal gaze of love off of him. I said, your son is Jesus Christ right now to you. Because whatever we do to anyone, we've done to him, and he needs your look of love now more than he's ever needed in his life. But that look of love is not an affirmation of every choice he makes. It's an affirmation that he's your son and you'll never take your love from him. And this poor woman just broke down in tears because she did love her son, but she just didn't know how to apply this on a daily basis. And so what they need is, I think, not like I said, just to listen. They need to be seen. Hold on to their hand with one hand, hold on to reality with the other hand, and don't let go of either hand. It'll create tension at points and maybe even some resentment. But I promise you, if you don't learn to speak the truth in love, they will resent you for all eternity for not having spoken the truth. Because right now, I'm telling you, there's a tsunami about to hit our shores. If you ever watch YouTube tsunami footage, it's not some big tidal wave. First thing to happen, the tide goes out. It's the lowest low tide you've ever seen. And if you don't know what that means, you're just going to walk out there. Hey, look, there's a shipwreck and a coral reef. This is pretty cool. But if you know what this means, you're like, oh, this is a tsunami. You run up the hill. And I'm telling you right now, our whole culture, from education to politics, pharmaceuticals, media, everything is out to sea with this transgender moment. But I'm telling you, what is about to hit our shore is an absolute tsunami of detransitioners. These are individuals who have begun the process of transitioning and realized that it wasn't the answer. And they're not just starting up blogs and little websites. They are joining communities. Reddit, hashtag Detrans, more than 50,000 people screaming from the rooftops. Get the kids off the blockers. It's not the answer. They're starting up lawsuits and they're winning. Over in England, Kira Bell, 16-year-old girl, puberty blockers, cross-sex hormones at 18, double mastectomy. Then she gets to her early 20s and she looks at her body and, what did I do to my body? And then she looks up, what did you adults let me do to my body? She sued the biggest gender clinic in the United Kingdom. Her court case went all the way up to the High Court in England, and these liberal progressive judges all ruled in her favor. And as a result, things are shifting in Europe, Scandinavia, Norway, Finland, Sweden, Amsterdam, backing off on puberty blockers. France banning puberty blockers. England, they're seeing the writing on the wall. This was based on very low quality evidence to begin with. Over here in America, it's pedal to the metal. It's like we've got the GPS on our phone. There's a 52-car pileup with black ice and casualties a quarter mile ahead on the freeway. What do? Cruise control. We're going right into the mess. And over in England, they don't have a clue what to do with the mess. The milk is out of the carton. They've changed the laws, categorizing crimes according to gender identity. Do you know what that means? The majority of female sex offenders in England are biological males. So where do you put them in the prisons? Well, he says he's female in the female prison. Oh, that's a great idea to have registered male sex offenders in female prisons? Well, what could go wrong there? Oh, well, let me try sexual assaults, rape, pregnancy in the female prisons. Well, what do? Women's domestic violence shelters, sports. They don't have an answer for this. It's almost like when I help my daughter for math. It's, fifth grade girl, we're doing math after dinner at the table. And I'm like, okay, well, let's see, you got that problem wrong. We're doing long division. Let's see what went wrong. And I get out my phone. Hey, Siri, how do I solve this fifth grade math problem? I'm like, well, that's an integer right there. And I said, you just missed the one at the beginning by one number. Because the beginning, the one digit was off. The error that flowed from it was compounded exponentially. And what this means is if we cannot distinguish something as simple as male from female, the error that will flow from that will be compounded exponentially. But the church prophesied this in Vatican II, so that when God is forgotten, the creature itself grows unintelligible, meaning that if we lose sight of supernatural realities, it will come to the point where we cannot even understand natural realities. And this is the point where I think theology can step in. Not with condemnation, but with clarity. Is the body reliable to show us our identity? Is it meaningless or meaningful? And so the church's answer to this disintegration of the human being is an integrated vision of man. John Paul II gave it to us in his theology of the body. And I know many of you were born just as he died. You didn't get to know this guy. This man was a giant, not only intellectually brilliant. First homily as Pope, he just gave in 11 different languages. But he was so human, down to earth. After becoming Pope, he's walking through the Vatican gardens, and he sees a landscaper there he hadn't met before. And he comes up, "Oh, I haven't met you before." The landscaper stands up. He's meeting the Pope, but his hands are full of mud. He's been pulling weeds or fixing sprinklers, and he can't shake the Pope's hand. John Paul saw it, reached in, grabbed him by his wrist, pulled him close, smeared his muddy hands on his white papal cassock, and said, "Don't worry, now that I'm the Pope, I don't have to do my laundry anymore." It's like, that guy's like, I think I'm gonna like my new boss here. And so he was just so down to earth. And one of the things he taught us in this theology of the body is that the human body is the only creation of God that makes a person visible. Animals have a body, but they're not a personal being. Angel is a personal being, but it doesn't have a body. So the human body alone makes a person visible. And it's easy enough to prove. If you say, "Hey, I'm going to the store," well, I'm willing to bet your body is going to the store as well. Because you don't have a body like you have a pair of jeans. Your body is you. But here's the problem. If we untether our identity from our body, your identity needs to attach to something. But what is it going to cling to if not the body? It attaches to the personality. But here's the problem. There are as many personalities as persons, and you'll end up with an endless spectrum of gender identities. But to me, this is not the end game, to have lots of genders. No, the end game is to erase sexual complementarity, because stamped into our body is an image of God. We have been created in the image of a life-giving communion of love. Our body not only reveals our identity, it reveals our calling. I mean, look at the distinctness of the human body. This idea that our sexuality is located in our reproductive organs and that's it is scientific nonsense. I mean, look at the body. For example, of a woman. In your ear, for example, women, are thousands of microscopic hair cells that vibrate with a greater intensity than men's do, which amplifies your ability to hear, to distinguish nuances and inflections in the human voice that are imperceptible to the male brain. I think there's entire conversations the male brain can't hear as well, but that's an entirely different conversation altogether. But if you've ever taught little kids, have you ever noticed you have to speak louder to the boys? Oh yeah, you do. You have to speak 8 decibels louder for the male brain to register speech at the same level the female brain will register speech. Now, it's not a guarantee that he's listening to you, but he can at least hear you at that point, okay? And so the hearing is different. Men typically are comfortable with sounds twice as loud as a woman. Men universally outperform women in locating the origin of a sound in 3-dimensional space. I'm walking through the woods. I hear a branch crack 35 yards, see it southeast. The man will pinpoint the origin of a sound without seeing it more accurately than a woman can. Men do a better job of blocking out ambient noise, whereas women do a better job of auditory multitasking. I'm eating dinner with my teenage daughter at a restaurant, and we're sitting there, and then there's a lull in the conversation. I said, "Mary, what are you thinking about?" She's like, "Shush." I'm like, "Shush." I'm like, we're the only people at the table. And like, turns out she's listening to all of the conversations of the people at the adjacent tables, all their personal relationship stuff. She's just drawing it all in. Even people she can't hear, she's reading their lips. She's like looking at body language and then she fills me in. She's like, he likes her more than she likes him, and those two are not getting along tonight. I'm like, man, I could have sworn we were the only 2 people at that restaurant. She's just gathering intel the entire time. Our ears are different. Your eyes are different. Women can see shades of color that men can't see. That's why you women come up with colors like mauve, fuchsia, chartreuse, taupe. It's like, what? All you need is a small box of crayons, all right? You don't need all that stuff. So, eyes are different. Men do a better job tracking objects moving through 3-dimensional space than women do. Eyes are different. Nose, women, at the base of your brain is your olfactory bulb. You have more than 7 million more cells in there than the guys do, which amplifies your ability to smell, distinguish between scents, especially if you're ovulating or pregnant. Shoo, the sensitivity goes through the roof, which means for you college guys, if your girlfriend ever walks in your dorm room and she walks in, she's like, "Hi, honey." And you're like, "What's the matter?" She's like, "Something died in there." And you're like, "I don't know, smells pretty good to me." It's like, no. Trust me, like wash your hockey uniform for the first time this presidency, okay? Don't just put cologne on it, okay? Wash it or burn the thing. And so, smell is different. The skin, some tests have shown no overlap, meaning the most sensitive man's skin is still less sensitive than the least sensitive woman's skin. But all of this is pointing to something deeper, the human heart. They did a great study of boys and girls, put them in a little room, and on the other side of a wall was a baby who was crying, and you could hear the baby through the intercom. And there were two buttons you could press, one to communicate with the baby, and the other button to shut the volume of the baby completely off. Well, you can probably see where this one's headed. So, and invariably little girls like, click, hey baby, how you doing in there? Boys walk over, problem solved. And so, but to me, these things do not reveal some tit for tat, battle of the sexes competition. No. It reveals sexual complementarity through this divine design. This is why I think the devil is so hell-bent on getting women to think you need to be masculinized in order to become powerful. It's nonsense. I had breakfast with a brilliant philosopher once named Dr. Alice von Hildebrand. And she said, yes. She said, men have power in what they do, but she said, women have power in who they are. And so the differences between us magnifies God. I mean, it's beautiful. And so all of this stuff is not to put us in some gender stereotypical box. In fact, I had breakfast once or lunch with this nun, and she was incredible. This woman was a nun, consecrated religious sister, and she was a doctor, and she was a surgeon, and she's a colonel in the United States Army. And I'm like, did you not feel like being an astronaut because you're lazy, just didn't get around to it? You're just like hogging all the vocations yourself and then just hoarding them in your convent. Like this woman was not doing these things instead of motherhood. She was mothering through these things. She understood that womanhood is not some box that she's got to fit into. It is a firm foundation upon which she can stand. The givenness of her sexual identity as a gift from a loving father. And although the gift might be a mystery at times, if we trust the heart of the giver, he'll show us the ultimate plan for us. And so if you're wrestling with your sense of sexual identity, I think what God would say to your heart is this: my beloved child, you were not born into the wrong body. You were born into the wrong culture, a culture that's telling you that you have to hurt your body in order to be your authentic self. Your body does not need to be reconstructed. It is this culture that needs to be reconstructed. And so I have created you for such a time as this to participate with me in the reconstruction of this broken culture. And this isn't just for those who wrestle with gender dysphoria. Everyone in this room is wrestling with their sexuality in one way or the other. But all of the answers to all of these questions is found in the most blessed sacrament. This is my body given up for you. Stamped into our bodies is this calling to find ourselves through the fullest giving of ourselves. And to help you live this out on a daily basis, when you go back to your parishes or colleges or whatever, we've created a couple of resources that we want to share with you. One, throw up on the slideshow here, we just created a course called Navigating Gender with Charity and Clarity. This is a 10-part course that if you want to take a deeper dive, today was 30 minutes. You can only cover so much in a half hour. And so if you want, you go to chastity.com, our website, the courses, you can scan it. It's a deep dive into all this. An interview I did also with a detransitioner shares her story. So if you work with people who may wrestle with this, or you just want a better understanding, scan the QR code, check that out.